Ladies and gentlemen, welcome to our special IVF segment. Today we have a very special guest with us, Dr. Aditi. So I would want please introduce yourself first.
Hello everyone, I'm Dr. Aditi Trivedi. I'm a practicing fertility specialist, obstetrician and gynecologist at Dr. Trivedi's Total Healthcare Center. We are based at Ghatkopar, Mumbai.
All right, lovely. So I have many questions for you. So let's start with the first question that what is infertility and how common it is among couples?
Yeah, so it's a very important question because infertility term is used very randomly nowadays. So infertility is basically when a couple is trying to conceive by keeping unprotected relation for at least a period of 1 year during the fertile periods and are not able to conceive. That is the time when we term it as infertility.
Okay. So what are the primary causes of infertility and in both men and women, and what are its treatment options?
Yeah, so the primary causes, the first, as we'll go first about females. In females, the most common cause is the age. So as age advances, the egg reserve, that is the egg giving capacity of a woman, which is also called as the ovarian reserve, it keeps on depleting. After the age of 35, it depletes drastically. And after the age of 40, almost when the women are approaching menopause, the egg reserve depletes to a very low level. So that is the main reason which can come in the way of conception. The second most common is due to tuberculosis, which is very prevalent in our country because there may be patients who have past history of tuberculosis. Simultaneously, they may have genital tuberculosis, which affects the fallopian tubes. And this is nothing but infection of the fallopian tube. That is the place where fertilization happens inside the body. So if the tubes are affected, if they are blocked, it will come in the way of pregnancy. Then there are various other pathologies like fibroids, which are nothing but benign tumors of the uterus. If the size of the fibroid is very large or the location of the fibroid is just next to the cavity, it may come in the way of conception. Fourth common cause is endometriosis. So endometriosis is a disease wherein there are foreign deposits of endometrial lining in wrong places. So it may be accumulated in the ovary or near the tubes. So this causes dystotic changes in the anatomy as well as it affects the egg quality, which may come in the way of pregnancy. In males, the most common reason is lifestyle. So smoking, alcohol, hookah, be it even passive smoking, does affect the sperm quality and quantity. And especially those working in factories or keeping laptop all the time on their lap, because this is nothing but exposing their genitals to a very warm temperature. There's a reason why the genitals are outside the body in males, because they cannot be kept at 37 degrees Celsius. They have to be at a lower temperature. So when they're exposed to a high temperature, it affects the sperm quantity, quality, as well as the motility of the sperms. Third most common thing is the infections. Any males having past history of mumps or tuberculosis or any other viral infection can affect the sperm or the semen parameters. And obviously unexplained infertility, wherein everything is common, everything is normal with both the male and the female partner, but still they are finding it difficult to conceive.
Okay. So can you please explain the process of vitro fertilization in simple terms, and what is ART?
See, ART is assisted reproductive technology. So basically it comprises of various treatment options wherein the conception is happening by some assistant by the fertility doctor. So it comprises of IUI and IVF. So first I'll talk about IUI. IUI is intrauterine insemination, wherein instead of the couple keeping relation naturally, we take the husband's semen sample, process it in the lab, and we insert it into the womb of the woman. All right, so that's how a conception will happen. The conception will happen inside the body, but we are just helping by processing the semen sample, energizing the sperms, and putting it as close to the tube in the uterus, which helps in improving the fertility rate. Now, when it comes to IVF, what we do is we give injections. So it's a 2-week procedure. It is not some rocket science. It is a simple day-care OPD procedure wherein for 10 days we give injection to the female partner for development of the eggs. So we want optimal number of eggs to develop over a period of 10 days. Once these eggs are ready, under general anesthesia, we retrieve them using under the guidance of transvaginal ultrasound. After retrieving those eggs, we take the male partner's semen sample and we fertilize those eggs with the partner's sperms, either by a procedure called as IVF or by a procedure called as ICSI. So IVF is nothing but in vitro fertilization. The fertilization process is happening outside the body. That's why it's called in vitro fertilization. Now, when we keep the eggs and the sperms together in a culture dish in the lab, and we culture the embryos, that is called as IVF. When it's male factor infertility, wherein the sperm count is very less or the motility is very less, they don't have a very good fertilization capacity. So in those cases, we do a procedure called as ICSI, which is known as intracytoplasmic sperm injection, wherein under very high power microscope, we individually see which is the best looking sperm, which is the most normal looking sperm with a good motility. We pick up that sperm and we inject it individually inside each and every egg to make sure that fertilization happens. Then over a period of next 3 days and some like 5 days, we see how many embryos have been fertilized, how the embryos are progressing. At every stage, there can be an embryonic block. So every day we see how the embryos are progressing. And according to the law, we cannot transfer more than 2 embryos. So these 2 good embryos, good quality embryos, we transfer into the female's womb. If the same cycle, it is fresh transfer. If the hormonal parameters are not right, or the lining is not very good, or there are too many eggs which are formed, in certain situations, we cannot do a fresh transfer. So we freeze all the embryos. Freezing is done in liquid nitrogen at minus 196 degrees Celsius. And you can freeze it for lifelong. As per rule, you can freeze it up to 10 years. And then we use those frozen embryos later on by doing a fresh frozen embryo transfer. And we transfer those embryos into the womb of the woman. And after 15 days of transfer, we do the pregnancy test, which will tell us whether there is a pregnancy, positive or negative.
Okay. So as per you, what are the success rates of IVF and what factors can influence the chances of success?
Okay, so that's a very tricky question, because like when IVF technology had started, at that time, the success rate way back 30 years back, it was around 5%. Now with advances in technology, advances in science, this success rate has increased to even up to 50 to 60%. But the most important factor which affects the success rate is the age. The success rate may be very high for women less than 30 years of age, but at the age of 35, the same success rate may be 25 to 30%. At the age of 40, it may decrease to 10 to 15%. At the age of 45, it may decrease to less than 10%. So age of the woman is the most important factor, and the egg reserve, because even at say 35 or 40 years of age, if the egg reserve is good, the egg quality is affected. There may be a lot of genetically abnormal eggs, which may not result in a pregnancy. And obviously the techniques being used. See, there are various other technical reasons, the fertility clinic doing it, the clinician, the embryologist, what kind of injections are being used, what kind of techniques are being used. So the success rate of a center depends on a lot of things, what standard protocols are being followed by the clinic. But in general, the success rate is 50 to 60%, but it varies a lot depending upon the age of the woman and the egg reserve.
Okay, great. So are there any lifestyle changes also which can improve the fertility and increase the chances of success with IVF?
Absolutely. All lifestyle changes, be it smoking, alcohol, hookah, is a complete no-no when you are planning a pregnancy, be it not even in IVF, but in general when you are planning a pregnancy, because smoking does affect the egg quality. Even once a patient conceives, a patient who is a chronic smoker, there were high chances of ectopic pregnancy and miscarriages. Smoking does affect the sperm parameters drastically. It causes fragmentation of DNA of the sperms, which may affect the fertilization potential of the sperms. Alcohol also, we would advise our patients to restrict when they are planning pregnancy. Hookah is very, very common in today's generation, and people don't even realize that even they may not be smoking hookah, but even sitting next to a person doing hookah, they are a passive smoker. And that also affects the sperm quality and the egg quality. And the most important thing is obesity. So processed foods should be avoided. weight loss, because all of this does affects the egg quality. Especially in patients with polycystic ovary syndrome, there's a lot of hormonal imbalance because of obesity, which can come in the way of conception. So definitely lifestyle modifications before planning pregnancy or IVF.
Okay. So are there any financial considerations also, like assistant options available for individuals who are undergoing IVF treatment? What do you like?
Finances, when it comes to any normal IVF cycle, costs around up to 2.5 lakhs. Okay. Now it all depends upon what is the egg reserve of the patient and what kind of injections are being used, because the injections are very, very costly when it comes to stimulation protocols used in IVF. Coming to options available for patients, there are many, many insurance companies in last few years, say in last 4 to 5 years, they have come up wherein they cover the fertility treatment as well. So you can check with your insurance, especially the ones working in corporates and they have license with the insurance company. Most of the procedures are covered in infertility. And obviously, many organizations do run charitable camps for infertile patients. So what in and around whichever area they are residing, they can check on whether some subsidies, some camps are going on which are providing treatment at a subsidized rate. Because see, at the end, the clinics does suffer because they have to spend from their own pocket, because these injections are extremely expensive. The patient must understand.
All right. So what are some alternative fertility treatments, procedures apart from IVF?
So like I said, apart from IVF, there is something called as intrauterine insemination, wherein, so everybody doesn't require IVF. So, right. So if the count is normal, husband's count is more than 10 million, if the motility is good, wife's egg reserve is not very less, and if she is less than 35 years of age, and if the tubes are open, that is the most important thing when you are considering intrauterine insemination, because your fertilization is happening inside the body. So when we are just releasing the semen sample inside the womb, the sperms in the sample will go and fertilize the egg in the tube. So the most important factor is the fallopian tube should be patent. Now, in some patients like PCOS, their main problem is that they are not ovulating regularly. Everything else is absolutely normal, it's just that the egg is not releasing. So we can give them certain medicines which are called as ovulation induction medicines. We give injection for the rupture of the eggs, and we monitor that rupture on the sonography, which is called as follicular monitoring. And then they can keep relations at home naturally with their partner and conceive naturally. Sometimes they may not even require IUI or IVF. So these are the other options which are available only in certain scenarios where IVF is not an absolute indication.
Okay, so what about the environmental factors or infertility?
Environmental factors, like I covered, like I say, lifestyle changes what we need to do. But like I said, women, husband who are chronic smokers, so they should restrain from smoking in front of their wives, because, you know, passive smoking also affects the egg quality. And like I said, in males, those who are working in factories, they should avoid high temperature near the private area, avoid keeping laptops on the lab, avoid too much of usage of mobile phones near you. You know, even while sleeping, don't keep it bedside, because the radiations can also affect the egg and the sperm quality. So these are certain environment, obviously pollution, which is not in our hand, but it does affect the egg quality and the sperm quality to some extent.
Okay, all right. One last question. What advice would you like to give to all the individuals, all couples who are just starting their journey towards parenthood and considering IVF?
Okay, so the most important factor is to be positive, to keep hopes, and not to come with very unrealistic expectations. See, IVF is not, we are not gods over here. It's not like a magical procedure. Okay, it does have a failure, certain amount of failure rate. So out of 10 couples, 4 to 5 couples will conceive in one cycle. So that practical thing they should keep in mind. A lot of support to their wives, because at the end the females are undergoing this procedure, they are taking injections daily, so they need to give a lot of emotional support to their wives. And thirdly, don't compare your journey to others. You don't know the other side of the story. So every story is different, everyone's life is different. So don't compare that, you know, they conceive, we are not able to conceive. Keep hope, it will happen someday. And those couples who are getting married at a later age, or they want to defer pregnancy for a longer time, please do embryo freezing, because at a stage in life when you really want to have kids, because of decrease in egg reserve, because of the age factor, it may not be possible for you at that stage. Then you may have to offer donor eggs. So instead of that, freeze your embryos at an earlier age. Even women who are not married, not planning to get married soon, please freeze your eggs at an earlier age, because your eggs are frozen at a genetic age at an earlier age than you're planning a pregnancy at 38 or 39. And your eggs are frozen at the age of 32. So it makes a big difference in pregnancy rates. All right.
All right. So thank you so much, Dr. Aditi, for being there with us and sharing your expertise. So remember, miracles happen, and today is all about hope and happiness. Keep smiling, keep believing, and keep spreading the love. Wishing you a very good evening, ma'am. Thank you so much once again. So this is the last one. Hashtag start your joy. This initiative is brought to you by Bharat, Serums, and vaccines. So once again, I would like to thank you and wishing you an amazing, amazing evening ahead. Thank you so much.
Thank you so much for having me here.
Thank you. Bye-bye.
92